Hi everyone, my name is Casey Smith here at the St. John Clark Pain Treatment Center here in Clearwater, Florida. Today what we're going to talk about is a common issue that we see coming into the clinic, and that is anterior shoulder pain, or what we also consider glenohumeral pain. Now your glenohumeral joint is just your shoulder. If you hear this term later on in the video, never mind it. Just understand that we're talking about the front of your shoulder and the muscles that affect that area. Now some common issues that we see can often be misuse, overuse, training injuries when you're working out, and often work injuries as well. Can cause injury to the front of the shoulder itself, and today we're going to talk about some of the muscles that can be affected by that area. Now you have a couple different muscles that attach in that area. You have your pec major, this big guy here in the front. You have your deltoid. The most common area that's straining your deltoid is your anterior deltoid. We have our bicep in the front as well for curling. And then we also have another muscle that attaches at the front of the shoulder called your subscapularis. Now your subscapularis, this is our subscapularis model, or our scapular model. The subscapularis is this big muscle here that attaches at the front of the glenohumeral joint itself. Now your shoulder, or your scapula, sits over your rib cage just like this to form your shoulder girdle. Now the subscapularis must be accessed through the armpit itself, and the irritation or the pull from the muscle on the tendon itself can cause shoulder pain. This is often a hidden shoulder pain muscle and can often be the primary pain source of your chronic pain. Now, one of these areas that we see the shoulder actually affected in during work is when you're sitting at the desk for a long period of time. Simply moving the keyboard or your mouse closer to you can eliminate this big internal rotation that we start to cause, or that outreach that can oftentimes flare up these muscles, such as the subscapularis, that can cause irritation and pain in the front of the shoulder. Now another issue that we see for workers as well, maybe you work in a storeroom, in the stock room, maybe you're unloading and loading freight for a living, lifting things, lifting heavy boxes, overhead lifting can often be an issue. Lifting with your legs, of course, not providing all that strain on your biceps themselves, and also when you're lifting, overhead press, try to externally rotate your shoulders as much as possible and push with the elbows functioning in their normal function track. Lifting this way is improper. You're loading the front of the deltoid quite a bit and can cause some strain and irritation over time. Now another issue that we see, which is much more common, is for all the lifters out there. All the guys that are lifting in the gym, you know, it's arm day, it's bench day again, you missed leg day last week, that's okay though. It's bench day again, so here we are, we're doing our chest presses, we're doing our military presses, we're trying to get those muscles big and strong. What we find is when you're coming off the bench improperly, what I mean by that is you're not setting your shoulders, you're not squaring off your elbows the way that they should be. When you're taking that weight off the rack itself, your shoulders are externally rotated or internally rotating, and you're actually loading the front of the deltoid improperly. The weight is not loading on the pec the way that it should be, and you're actually stressing the shoulder itself. Same goes for military presses. Keep those shoulders out, lift the weight, support the weight where it should be. Don't let those shoulders fall in or those elbows fall in and start causing more strain in the front of the pec and the anterior deltoid that's completely necessary. If you have any more questions, you can visit the St. John Clark Pain Treatment Center website, and also we will be covering a video for posterior shoulder pain that could often lead to frozen shoulder or freezing of the shoulder itself. Until next time, my name is Casey Smith with the St. John Clark Pain Treatment Center. Have a good one.